Welcome to the latest episode of the Real World Nutrition Podcast. This is episode 217, Social Determinants of Health, What Food Access Really Looks Like. Hi everyone, welcome back to the Real World Nutrition Podcast. I'm Shelly Ryell, registered dietitian nutritionist, and today the focus is on social determinants of health and how they show up in everyday life. Now, these are not abstract ideas, these social determinants of health. They are conditions that shape what people can realistically do with their health. Now, there's no shortage of messages out there telling people to just try harder or have more discipline, and that kind of ignores reality. Decisions about food and lifestyle are not made in a bubble. They're made within the context of a person's environment, their resources, their stress level, and what is actually available to them. So I want to break this down in a way that makes sense, because as health professionals, we talk about these social determinants of health, and that just telling people to choose fruits and vegetables or choose healthier options isn't always as straightforward as what it may seem. So, what social determinants of health really are? So, social determinants of health are the factors outside of a person's motivation. So, they include income, education, transportation, housing stability, neighborhood safety, access to health care, job demands, food availability, and the policies built around all of this. So these various things shape the foundation that a person is working with. So all of these things influence a person's health, a person's physical health. And a lot of people really want to believe that our health status, is entirely about choice. And it is not. The conditions people live in influences the choices they even have access to. So that doesn't remove personal responsibility, but it does recognize that responsibility can look different depending on the circumstances. So I'm going to address many of these circumstances to help people better understand what is meant by these social determinants of health. So income and food access. Because I want to start with income, as it is one of the biggest drivers. Healthy food is not cheap. And when money is tight, people choose the foods that will fill them up, fit in the budget, and last longer. So they're not choosing based on macronutrient balance. They're choosing based on survival and practicality. Now, someone with a comfortable income can walk into a store, grab whatever sounds good, and not worry about the total. Someone living paycheck to paycheck, hoping that they can cover their rent, their utilities, and that their car doesn't break down, they don't have this luxury of walking into the grocery store and grabbing whatever sounds good. They make trade-offs every single time they shop. Next up, transportation and time. Transportation plays a bigger role than most people think. Think about the last time you went to the grocery store. How did you get there? And if you had to walk, would you have been able to carry all your groceries? Now, not everyone has access to a private car. Public transportation may not run near a full grocery store, or may not run at times in which people can actually go. For some, the closest place to buy food is a gas station or a small convenience store. And then there's the time. If a person works long hours or irregular hours, prepping recipes is just not happening, and even shopping becomes harder. Expecting people in these situations to follow this perfect nutrition guidance just makes no sense. They're working with what they have. Now, next is education and nutrition literacy. Now, let's think about this. Nutrition information is everywhere. And if you're listening to this podcast, you're interested in nutrition education. But in my years of experience, nutrition education is not widely available. Most people don't get it in school growing up. In college, they choose to take these classes if they're going to college. There's a lot of situations where nutrition education is just never given. And then when someone has never been taught how to cook or has been given mixed messages about what healthy means, advice like eat more whole grains, increase fiber, have more fruits and vegetables does not automatically translate into real behavior. And truly, people who have the nutrition education don't always translate that information to real behavior. Now, when I say nutrition literacy and education, this is not meaning a lack of intelligence. It's a lack of access to accurate and consistent information when it comes to nutrition. And often the people who need it the most are the ones who have the hardest time getting it or have the least access to it. Now, next, I mentioned this as one of the social determinants, is neighborhood safety and physical activity. So movement is always encouraged for health, and it should be. And I say this all the time. Pretty much everybody I encounter can walk. So why telling somebody to walk more isn't really going to mean anything if their neighborhood is unsafe, if there's no sidewalks, if the air quality is not ideal. And people do not choose inactivity because they're lazy. Many people live in areas where walking outside just does not feel safe or practical. And then there's access to healthcare. Healthcare access is another major factor. Some people cannot afford regular checkups. Some cannot take time off of work without losing pay. And again, we have transportation to consider as well. So if somebody is wanting to even just get a checkup, think about the last time you went to the doctor and how long that took, plus the transportation time. If you are not getting paid for that time, it's less likely that you're going to do that, especially when you have a very minimal income. Some people don't have providers nearby. So chronic conditions go unmanaged. A lot of times the regular doctor's offices aren't open on weekends. So these are different situations where preventative care does not happen. And advice given in quick clinic visits may never get followed up on. And then the stress and mental load. This is a piece that gets dismissed most often. Chronic stress affects appetite, it affects sleep, it affects decision making, and our energy. It changes how people eat. So when life is unstable, the brain prioritizes survival, not long-term planning. So the message people hear is just make better choices. Their message their body hears, get through the day. So now I want to talk about SNAP. This came up a lot in the last couple months here in fall of 2025. SNAP is the Supplemental Nutrition Assistance Program. And I tell you what, this is often a misunderstood program. Many people have opinions about it without knowing how it works. SNAP is not a bottomless grocery budget. It's a supplement. The key word there is supplement. It is not meant to cover every single meal for an entire month. And for many households, it covers a fraction of what they need. A lot of times children are getting their school breakfast and school lunch, and the SNAP covers the meals on the weekend and evenings, if that. People assume SNAP benefits allow for a cart full of fresh produce and high-end protein, or even healthier options in general. In reality, the benefit amount is low, and food prices just continue to rise. And a lot of judgment gets placed on what people using SNAP choose to buy. And often those judgments are made by people who have never tried to stretch those dollars across a whole month. When you have limited funds, you buy what will last and what will keep everyone fed. Now I know, yes, there are people who will buy sodas, buy the ice cream, buy those types of foods. However, that's not the majority of the people on SNAP. They're doing the best they can by buying cereals and things that will last longer, canned foods, things that will last longer. So it's not about poor priorities. It's about math. It's about economics. And math and economics always wins. Now, I want to address some myths here. The myth of just cook more. People say things, well, if they just cooked at home, they would be healthier. But cooking assumes a kitchen, cookware, time, and a predictable schedule. Not everyone has these. Temporary housing, overcrowded living situations, and unreliable utilities can make cooking harder. Some families only have access to a microwave. Some rely on shared kitchens with limited space, meaning limited refrigeration. So these circumstances change what is possible. So again, going back to people buying cereals, people buying canned goods, people buying things that are shelf stable and can last a long time is more practical if they don't have the refrigerator, if they don't have an oven, if they don't have pots and pans and measuring cups and ways to clean them. Now the myth, healthier food is always cheaper. Really, there is a common claim that healthier food is cheaper. I hear more that healthier food is more expensive. So really, here's the thing. Sometimes the healthier food is cheaper, sometimes it's not. Fresh produce spoils faster, which means more trips to the grocery store, more risk of food waste. And again, if there's not refrigeration or there is a shared kitchen space, those things may be difficult to hold on to. Lean proteins are expensive. Even canned fish isn't that cheap. Whole grain products cost more. So not everybody has the ability to gamble on foods that might go bad before they can be used. So I want to really put a spotlight here on how these social determinants of health, how these factors show up in real life for some people. So here's what social determinants of health look like in daily life. A parent skipping meals so the kids can eat. Someone choosing shelf-stable foods because of unpredictable work hours mean they can't cook at regular times. A person choosing fast food not because they prefer it, but because the bus drops them off near fast food. Someone avoiding the doctor because missing work means losing income, and in some cases, risk of losing the job. And food choices made out of exhaustion, not preference. Think about when you're tired. What are you choosing to eat? So this isn't about the lack of care or concern for their own health. It's about living within the constraints of the environment. So why this matters for me as a nutritional professional or anyone giving advice or anyone armchairing the advice, meaning why can't people just make better choices? When health advice does not consider real-life circumstances, it's useless. People tune out. They feel judged or misunderstood. The goal shouldn't be getting everything right. The goal should be getting food within the reality of what they live in. Nutrition guidance must be practical. Removing food dyes without changing the social determinants of health does nothing. Nutrition guidance must take into account these barriers. And they must respect the fact that people are doing the best they can with the resources they have. And yes, there will be people who do abuse the system. There will be people who aren't making choices that are even remotely healthy. And at the same time, it's not the majority of people who have these benefits. So what can help? I always tell people practical steps make a difference. Small changes matter. And this is from people who are supporting those who have these social determinants of health that can be challenging. So rather than telling them to choose fruits and vegetables, I still tell them to choose fruits and vegetables, but I encourage don't overlook canned. That's fine. I'd rather you have fruits and veggies, even if they're in a can. And they won't go bad. You don't have to worry about them spoiling. And I also tell them to make sure they have a pop top on them if they don't have a can opener. Encouraging that these small changes matter. As health professionals or people giving advice, providing a supportive environment is important and reducing judgment. So, instead of asking why people aren't making healthier choices, maybe it's more helpful to ask what stands in the way, what small shifts might fit their current situation, and why, here in the United States of America, hunger is an issue where people can't have access to healthy food options because of these social determinants of health. So with that, social determinants of health shape a person's options long before they're even at the point of making a choice. And recognizing this is not lowering expectations, it's acknowledging reality. When the conversation is more honest, more compassionate, people feel supported instead of criticized. And that's where real change can begin. And with that, I wrote a blog about all of this information about these social determinants of health and SNAP. This is something where I've mentioned this before. I've not realized how passionate I am about this topic of people having access to food and hunger being an issue. But it really is something that's what people think about year-round, not just at the holidays. So you can look for that link in the show notes. And with that, I want to thank you for listening. Share this with anybody who might be able to benefit from it, as in people who are maybe judging people because of their poor nutrition choices or their perceived poor nutrition choices. And maybe volunteer or donate to help the food banks and the various places that help support these individuals as well. And with that, thanks for listening so much to this. Thanks for being here. You take care, and bye for now.